Well, good afternoon and welcome to the Minister's Update, Accelerating Ontario's Health Teams. So glad that you can be joining us from around the province of Ontario today. Just want to take care of a couple of housekeeping items before we get to our first presenter. Today we are using Microsoft's Artificial Intelligent Closed Captioning. If you'd like to take advantage of that, please just move your mouse on screen. Once you do, you'll see a small CC button appear. If you click on that, you'll start to get the closed captioning in English at the bottom of your screen. If you'd prefer to have that in French today, there is a small toggle switch to the right of the CC button. If you click on that, you'll be able to toggle back and forth between English and French. With that, I'd like to turn things over to the Associate Deputy Minister, Health Integration and Partnerships. Please welcome Alison Blair. Alison, good afternoon.
Good afternoon, Rob, and hello to everybody. Thank you for joining us today. My name is Alison Blair, and I'm the Associate Deputy Minister of Health Integration and Partnerships at the Ministry of Health, and I'll be the MC for today's session. Last November, I remember it like yesterday, the ministry held a webinar to share the government's plan to accelerate OHT progress through the Path Forward document. And today we're pleased to provide, again with the minister with us, to provide an update on how we plan to expedite that direction and share a commitment to ongoing OHT success. But I'd like to begin our time together by acknowledging that we're gathered virtually today on the traditional and ancestral lands of Indigenous peoples across Turtle Island. This is especially important as we approach the National Day for Truth and Reconciliation on Saturday. The work we'll do together in OHTs directly relates to many of the calls to action from the Truth and Reconciliation Commission. Number 19 is about closing gaps in health outcomes. Number 22 is on recognizing the value of Indigenous healing practices, and there are many more that will be relevant to us on our OHT journey together. I'm personally located in Toronto, also known as Tekaronto, and on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabeg, the Chippewa, the Haudenosaunee, and the Wendat peoples. Toronto is subject to the Dish with One Spoon Wampum Belt Covenant, a treaty between the Haudenosaunee and Anishinaabe peoples to peaceably share and care for the resources around the Great Lakes. Today, Toronto is home to many diverse First Nations, Inuit, and Métis people. I also acknowledge that there are 46 treaties and other agreements that cover the territory now called Ontario. We're grateful for the opportunity to live, work, and meet on these territories. We show our respect to the Indigenous peoples of this land today and all days, and we stand in solidarity with murdered and missing women, girls, transgender, and two-spirited people. To the First Nations, Inuit, and Métis people on the call today, I thank you for joining and for your partnership. I offer my commitment to truth and reconciliation as we continue our OHT journey together, and I also offer our commitment to engaging with Indigenous partners as we advance this new OHT direction today. So for today, we're happy to be joined by the Honourable Sylvia Jones, Deputy Premier and Minister of Health, who will share an update on the government's plan to accelerate OHT impact. Following Minister Jones, we're thrilled to have Betty Lou Christie, the Chair of the Minister's Patient and Family Advisory Council, here with us to share her reflections on the next steps in OHT acceleration. I'll then have the pleasure of moderating a question and answer period with Dr. Catherine Yu, Board Chair of the East Toronto Family Practice Network, which is part of the East Toronto Health Partners OHT. Catherine is also the co-chair of the OHT Service Transformation Advisory Committee. And we have Eric Vandewaal, the co-chair of both the Burlington Ontario Health Team Steering Committee and the OHT Governance and Operations Advisory Committee. And we'll also have my colleagues, Dr. Sasha Bhatia from Ontario Health and Rhonda McMichael from the ministry, who will join us for that as well. This session will be recorded and made available for later viewing as well, in case you want to see it again. With that, I'm pleased to welcome Minister Jones.
Well, thank you very much, Alison, and good afternoon, everyone. I am very pleased to join you today to share an update on our government's work, our Your Health plan to improve the healthcare experience of Ontarians at every stage of life for years to come. An essential part of our plan is to connect patients with the right care in the right place, and the work you have done collectively to accelerate the impact of Ontario health teams is absolutely crucial to this work. Since 2019, Ontario Health Teams have been centers of connected care, bringing together healthcare providers, including primary care, mental health services, and home and community care as a team to ensure people can move easily between providers. With 57 teams now across the province, we are so close to our goal of achieving full provincial coverage, ensuring that every person in Ontario has the support and access of an Ontario Health Team. Last year, our government released the Path Forward, a plan to make sure Ontario Health Teams are built to last and positioned to deliver connected and convenient care province-wide. Ontario Health Teams have achieved tremendous progress to date, and to ensure their continued success in delivering care to Ontarians where and when they need it, I am pleased to share that our government will be investing up to $43 million in Ontario Health Teams. Our government's investment means that starting this April, each Ontario Health Team will receive up to $2.2 million over 3 years, providing consistent and stable funding for every team across Ontario so that they can continue to provide connected care for Ontarians in their communities. The Ministry of Health has also been working with Ontario Health to bring the Path Forward to life and planning for the potential designation of Ontario Health Teams. As I shared earlier this month, our government is modernizing the delivery of home care through a 3-point plan that includes developing Ontario Health Teams to take on the delivery of home and community care. The work ahead for Ontario Health Team acceleration and home care modernization is an exciting step forward to improve the system of care delivery, and we recognize it represents a major undertaking for the health system. For this reason, our government is taking a carefully planned, phased approach to Ontario Health Team acceleration to ensure successful implementation across the province. An initial group of 12 Ontario Health Teams will be supported to advance rapidly towards maturity, including getting ready to take on home care responsibilities and being considered for designation under the Connecting Care Act. With support from the ministry, these teams will lead the way for all Ontario Health Teams to follow by implementing new models of care, preparing for home care transition, and building a common structure to support these aims. This initial group of Ontario Health Teams will share lessons learned with all of our other teams to support continuous learning and readiness for the next phase of implementation. Together, new stable funding and the selection of 12 Ontario Health Teams to advance towards their full potential will ensure success in achieving the next phase of Ontario Health Team maturity. And our shared goal is of making it easier for Ontarians, no matter where they live, to connect to consistent, high-quality care in their community. I appreciate and understand that these are major changes, and I must say how much I appreciate that you have stuck with us and worked so hard in your community together on the integration piece. And I just want to say personally, and on behalf of a very large ministry team that is supporting you, thank you. It's now my pleasure to pass it over to Betty Lou Christie, the chair of our Patient and Family Advisory Council. Thank you. Stay well.
Thank you so much, Minister Jones, and hello, everyone. My name is Betty Lou Christie, and I am the chair of the Minister's Patient and Family Advisory Council. I'm so thrilled to have the opportunity to speak with you today. I have had a front row seat to OHT development over the last 3 years that I have been in this role. I've heard from OHTs early in the application stage about their vision and plans, then saw OHTs grow their partnerships and build their patient family advisory councils once they were approved. And after a few years of implementation, I've seen mature OHTs truly embed co-design and partnership and take on leading practices such as having patient family caregiver leadership in their governance. Wherever you are in your development as an OHT, I offer my heartfelt congratulations for your work to date and the commitment to partnering with local patients, families, and caregivers. With the Minister's update today on OHT acceleration, I see a tremendous opportunity for all OHTs to learn and grow together. I know that all OHTs will benefit from the longer runway for implementation funding, and they will also benefit by learning from the group of the 12 OHTs that will take the first steps in removing barriers. I encourage all OHTs to renew your commitment to patient, family, and caregiver partnership through the opportunities ahead. For the 12 OHTs, I challenge you to be bold and drive towards true culture change where patients, families, and caregivers are real, authentic partners in building your OHT to last. You have the opportunity and in fact the responsibility to set a strong example for all OHTs to follow in this regard. For all OHTs, with the commitment the Minister has shared for longer-term funding, you have the opportunity to advance your planning and activities with a longer-term view. I challenge you to embed patient partnership and co-design in all of these activities. I have the privilege through the Minister's Patient Family Advisory Council to advise the Ministry on the OHT policies and programs under this new acceleration framework. I look forward to continuing this collaboration to ensure OHTs can succeed in the next phase of implementation. I am so grateful to share these reflections today. Thank you for your fantastic work, and I look forward to accelerating OHT impact together. And I'm going to bounce it over to Allison now.
Thank you so much, Betty Lou. And a big thank you to Minister Jones for your remarks and to Betty Lou for re-emphasizing the importance of the meaningful partnership with patients, families, and caregivers in this next stage of implementation. I know all of the OHT participants on the call are taking that to heart, and I also know that Betty Lou will keep us accountable for it. So as Minister Jones shared, approved OHTs will be eligible to receive up to $750,000 per year for 3 years starting April 2024 to support their ongoing implementation of the OHT model. In addition, the 12 OHTs that have been selected to implement the Path Forward direction and be the first to be considered for the potential designation are also listed on this slide. I'm going to give you a few seconds to have a look at that. Now, we know that you may have questions. We tried to think of some of the top ones, so I'm going to move us to a moderated Q&A session with Dr. Sasha Bhatia, Rhonda McMichael, Dr. Catherine Yu, and Eric Vanderwall to address what may be top of mind. Just a quick note that throughout this process, there will be many opportunities to have interactive sessions on the OHTs and how this will all work. But group discussion is hard with about 1,500 people who are on the call right now. Hopefully we've picked some of the harder questions to cover in this moderated session. And I also understand there will be opportunities to ask questions tomorrow at 10 a.m. for a webinar, which Ontario Health is going to be hosting for all OHTs and their members. So welcome to Catherine, Eric, Sasha, and Rhonda. Thanks for joining us for the Q&A, and we will jump right in. So first of all, we heard Minister Jones say that the 12 OHTs will implement a suite of patient-facing and structural deliverables aligned with the direction of the Path Forward on a rapid timeline. So Rhonda, we're hoping you could share what milestones the 12 OHTs will be supported to achieve.
Great. Thanks a lot, Allison, and welcome and hello to everyone on the call today. So the Minister mentioned a lot of what I will reinforce today, but between 2019 and 2022, OHT implementation was really focused on introducing the model, advancing provincial coverage, and supporting teams to establish themselves through building partnerships So, and also is coming to a common understanding of how they could work together to deliver care differently, all the while using a population health management approach. So our vision for OHTs, I want to underscore, has not changed. The building blocks set out in 2019 continue to guide our work. And with the release of the Path Forward in November, we are concentrating our focus on accelerating OHT impact. So one way we will do that is by working with the 12 OHTs that we have outlined today that will advance first to maturity and be considered for potential designation, as the minister outlined, followed by additional teams over time. So the phased approach is really meant to factor in the degree of change and the attention required for success. We've thought long and hard and put a lot of planning into this. And we do believe it will position us to better support all OHTs ultimately. So the 12 OHTs will be supported to achieve a set of standardized structural and patient-facing milestones on a rapid timeline. So from a structural standpoint, the expectations would include the creation of a not-for-profit corporation. These will all be familiar. Establishing a primary care network, standardizing back office supports through an operational support provider, and developing a home care readiness plan for the eventual delivery of home care. To expand the team's patient-facing impact and as well as building their capacity in population health management, the teams will put in place a patient navigation solution that builds on work done to date and that integrates with Health 811. They will implement at least 2 integrated clinical pathways, starting with congestive heart failure and COPD, and continue their work on local signature initiatives. So the 12 teams will play a crucial role in knowledge transfer, guidance development, and the peer-to-peer leadership that will really inform the provincial rollout and help to accelerate it. So there will be direction that will be there for other OHTs to follow. So that gives you an overview of what our expectations are and the connection between the 12 and the broader group of OHTs. Thanks. Over to you, Allison. Back to you.
Thanks so much, Rhonda. That was great. The next question is about team selection, and I'm going to ask this one of Sasha. Ontario Health holds an important role in OHT implementation and works directly with them to support them to progress. Would you be able to speak about how the 12 OHTs were selected?
Yeah, thanks so much, Allison, and it's a real pleasure to be here with all of you today. We are at Ontario Health grateful for the relationships that I think we've been able to build with all of the OHTs over the course of the last couple of years. And I think that relationship has allowed us to better understand how to support each of the teams based on their unique needs. We know that OHTs are at different stages of implementation. Some of the newest teams, in fact, were just approved a few months ago, whereas some of the first cohort of teams were approved over 3 years ago. So each of them has different strengths based on local context and priorities. So obviously, we had to put together some standardized criteria by how we made, we moved this forward. And so to support the ministry's direction with this work, with a smaller group of teams to advance towards potential designation on an accelerated path, we were asked at Ontario Health to conduct an assessment of all OHTs against key domains with the path forward direction, such as governance and leadership, primary care advancement, clinical and population health management. There are a range of inputs that supported this assessment, so it wasn't simply one set of data points. We looked at TPA reports that the OHT submitted to Ontario Health, the results of an all OHT survey conducted in the spring that was important to supplement information about priorities, and then also did an analysis through our regional leads that often work with the teams on the ground. As we formed advice to the ministry, considerations including regional distribution and local context to inform the selection of this discrete and diverse group of OHTs was sought. And we wanted to make sure that regardless, we had a representative selection of OHTs across that came from different contexts that would serve as sort of some of the key learning vehicles to be able to advance and learn, so that all OHTs will be able to move towards some degree of designation. And so through the assessment, Ontario Health had identified a set of OHTs that demonstrated a high degree of readiness to implement the direction set out in the path forward and the potential to take on additional responsibilities. But our most important learning through this entire exercise is that all OHTs have made significant progress in implementing the model. And so we recognize and commend the success of all OHTs and are confident that the lessons learned from the initial 12 OHTs that will be leveraged and amplified to support all OHTs towards maturity. At Ontario Health, we're deeply committed to supporting all the OHTs to continue their work to integrate care in their communities. And as Allison mentioned, as a next step, the team at Ontario Health will be supporting a follow-up webinar for all OHTs tomorrow at 10 a.m. to provide more detail on today's announcement and provide an opportunity for an interactive Q&A with all of our OHT partners. Thank you very much.
Super. Thanks so much, Sasha. Great and wonderful about the webinar and the interactiveness of it tomorrow. I think that'll be really exciting. Eric and Catherine, it's great to have you join us today, wearing both your hats as leaders within your OHTs and also as co-chairs for the recently formed OHT advisory committees. Eric, you for the OHT Governance and Operations Advisory Committee, and Catherine, you for the OHT Service Transformation Advisory Committee. I know the Ministry and Ontario Health will continue to look to those advisory committees and other forums for engagement to inform the policy and program guidance for all OHTs and find ways to link the learnings from those 12 OHTs confirmed today. I'm wondering if you would both be able to share your perspectives on the progress to date within the advisory committees and how the committee's advice will support all the OHTs with the path forward. Why don't we start with Eric?
Thank you, Allison, for the opportunity to be here today. So the OHT Governance and Advisory Committee has met 4 times to date, and we've had the opportunity to really dig into some key aspects of OHT governance, including things like potential corporate objects for OHT not-for-profit corporations, OHT governance and operating structures, and this week we started discussions on board composition. I think one of the greatest strengths of our OHT Advisory Committee model is the breadth of perspectives that are at the table. The discussions have been honest, constructive, and grounded in the experience of each member's OHT. As some of today's viewers may know, the Burlington OHT has been pursuing incorporation for the past 18 months. We've had the opportunity to learn from our neighbor, the Greater Hamilton Health Network OHT, and participate in peer-to-peer learning. As we continue to advance our governance structure, we're looking forward to learning from both other OHTs, as well as sharing our experiences to inform the processes, guidance, and templates for other OH teams to follow. I'd like to share with you some of our key learnings to date as a committee, and something that's become pretty clear is there's a need to strike a balance between governance guidance that creates common standards for all OHTs and guidance that offers flexibility for local context, readiness, and the evolving maturity of an OHT over time. So while there must be common standards for all OHTs, there are unique interests and groups. For example, Indigenous groups who may require a different governance relationship with an OHT versus being part of an OHT incorporation model at the outset. Another key learning is timing and readiness of OHTs to pursue incorporation, and in particular, the importance of strong, positive, and trusting relationships being in place as a key success factor prior to pursuing the next step of incorporation. If I could offer OHT's advice on what to work on now as we anticipate the release of governance guidance, I'd encourage OHTs to focus on continuing to foster and build trust amongst members. I'd also suggest that OHTs consider stress testing. So stress test your current collaboration and decision-making model by running through different scenarios to identify whether your model can see your OHT member team through complex decisions successfully. Similarly, where member interests may conflict, the current collaboration model may not be meeting the mark. So try to identify why not. I think it's really important that working through these conflicting interests now sets up an OHT's incorporation process and model for success. For the Burlington OHT, the limitation of our collaboration and decision-making model is with respect to liability, insurability, and indemnification. These risks are predominant concern amongst our physician partners and was one of the primary reasons we decided to pursue incorporation. So thank you again, Alison, for the opportunity to participate in today's webinar. I hope these insights were helpful.
They were very much so, Eric, and I'm sure everybody on the call also thought that. Thank you for sharing them. So I'll ask the same of Catherine, but from the perspective of the Service Transformation Committee. Wondered if you could share lessons learned, what you're learning, how progress is going. Catherine.
Thank you, Alison, and thank you for the opportunity to speak at the webinar today. Similar to the Governance and Operations Advisory Committee, the Service Transformation Advisory Committee has drawn strength from the range of experiences, expertise, and viewpoints that we have had at the table. We have met 3 times to date, and so far our discussions have focused primarily on primary care networks, the key roles and functions that they carry out, and how they interface with other activities OHTs are engaged in, such as integrated clinical pathways. Perhaps I could follow on Eric's advice to other OHTs on what to work on now as we await more direction on primary care networks. My hope is that OHTs and partners within can continue to lean in and support the formation and development of a coordinated and organized primary care collaborative within OHTs, as this is an incredibly important foundation for a successful integrated care system. If I might share briefly our experience in East Toronto, our primary care network, the East Toronto Family Practice Network, was established prior to our OHT's official launch as an Ontario Health Team. It was with the strong support of our OHT partners, inclusive of our local hospital, health and social service agency partners, and community members living in East Toronto, that we were all able to pull together primary care practices around an organized primary care network, working with the rest of the healthcare system. Conversely, the existence of our primary care network has given our OHT a strategic and operational advantage when it came to planning and delivering integrated care initiatives. Together, we have been co-designing and co-leading the active implementation of solutions for many of our healthcare system challenges, such as improving access to comprehensive primary care, especially for populations that need it the most. So based on the path forward direction and the work ahead that OHTs will need to engage in to be considered for designation, having a strong primary care base and partnerships will be critical for success. While every OHT is in varying stages of implementation, building primary care partnerships has been something all teams have been doing, and that work shouldn't stop in anticipation of forthcoming guidance. Now is the time for primary care leadership structures to mature to its next phase. We do need to become better organized, coordinated, and integrated within OHTs. Decades-long evidence and literature pointing to organized primary care as fundamental to an integrated system needs to be translated into practice as we try to meet the serious challenges that currently befall our healthcare system. I know that my fellow primary care leaders and champions across OHTs and across different regions are eager to take on this work. And then all this to say, Alison, that I do look forward to the continued discussions through the Service Transformation Advisory Committee, and I am confident that the members will do our very best in representing and ultimately supporting our fellow OHTs as we provide advice to Ontario Health and the Ministry. Thanks for the opportunity to speak.
Thank you both, Eric and Catherine. That was great and so inspiring. And I think certainly your words about how we move forward and some of the examples will really help to propel all of us forward. So we look forward to continued collaboration to ensure that the work remains informed by the OHT's expertise and experiences, some of which Eric and Catherine have shared with us today. That concludes our facilitated Q&A session. Thank you so much, Eric, Catherine, Rhonda, and Sasha for joining us today and for your insights. So now if we think about next steps, as you've heard today, the Ministry and Ontario Health are committed to the long-term success of OHTs, and we've been working together to advance initiatives across key areas to support your next steps. And when we look ahead, so first, the Ministry and Ontario Health will work together to issue agreements and flow funding for April 2024. So I'm sure that's an exciting prospect for all of you. Starting in Q3 23-24, the Ministry and Ontario Health plan to release guidance, resources, and supports for OHTs on key elements of the path forward, including on primary care networks and on governance. And lastly, the Ministry has heard strong interest from OHTs in having an implementation roadmap to support their progress. The Ministry is developing an OHT maturity framework that will help OHTs in their journey from their current state to a mature state. OHTs will have the opportunity to inform this framework through various channels, including the OHT advisory committees that we talked about today, as well as regional OHT collaborative tables. And we hope to continue an open and transparent line of communication with you on the progress of all these initiatives. A webinar recording will be made available. And if you have questions about today's update, please feel free to reach out to your Ontario Health OHT regional point of contact, as well as asking any questions at Ontario Health's webinars for all OHTs tomorrow at 10. It's worth reflecting on the successes of OHTs to date, as the Minister did at the beginning. They've been truly remarkable. You're demonstrating the value of population health management, integrated care, and teamwork toward a shared vision. And this plan for OHT acceleration will better position us to remove barriers, codify the lessons learned, and support successful implementation across all the OHTs. Your commitment to a connected healthcare system that meets patients' needs is evident in all that you're doing and in every OHT. And I look forward to seeing how each of your OHTs continues to grow. Thank you, everybody, for attending here and for joining us today, and I hope you have a great evening. Thanks so much, and we'll see you again soon.
You've been attending today's Minister's Update Accelerating Ontario's Health Teams. This ends our broadcast. Enjoy the rest of your day. Take care. Stay safe.